Good morning, everyone. We are reporting 48 new cases of COVID-19 today. That does include one new hospitalization. We have 7 additional individuals who have recovered from COVID-19. We are also reporting 2 additional deaths today, and we have 300 in total. That does mean that we have 288 cases of COVID-19 in the state of South Dakota. 23 individuals in total have been hospitalized and 4 total deaths. We do have 91 individuals that have fully recovered. The community impact map, there are no updates for today. I'll go ahead and just provide a quick rundown of the counties that are being added today. We have 1 new case in Bonham County, 1 in Brookings, 4 in Brown, 1 in Coddington, 1 in Lincoln, 36 in Minnehaha, and 4 in Yankton. The age range of those individuals, we have 1 person in the 0 to 19 year age range, 7 in the 20 to 29 year age range, 11 in the 30 to 39 year age range, 9 in the 40 to 49 year age range, 13 in the 50 to 59 year age range, 7 in the 60 to 69 year age range. And then for the breakdown of cases by sex, we have 29 that were male and 19 that were female. That is our update for today.
With that, Dr. Clayton is here to take your questions along with Secretary Malcolm-Risden. And so if you unmute your line by hitting *6, you're able to ask a question. And we'll take the first question whenever you are ready.
Yeah, this is Trevor Mitchell with the Argus Leader.
Go ahead, Trevor.
Yeah, I was wondering whether you're able to confirm the 2 new deaths. Are those the resident of Avera Prince of Peace and State Rep Bob Glanzer, who have been previously announced but not added to the counts as of yet?
We cannot specifically identify those individuals. The information that we provide each individual information to the media. We are still held to confidentiality for any death. So I can say that we have 2 new deaths that have been reported.
Okay.
This is Mark Pioneer. Radios from the Keloland News. I need to ask about death certificates and the use of death certificates to confirm COVID-19. Seems like there's a lag behind education.
The information is just a brief, time delay for individuals that are reported to our website, but that is to help ensure that the information that we're reporting to you is correct and is based on the information that is available to the clinician. So once we do have the death certified, we do report that information.
This is Kim Malcolm-Risden. I would just add that by state law, there's a 5-day window upon which a death certificate needs to be certified by the attending physician or medical examiner. And so sometimes that just has to be part of the process as well.
And the other thing that I would like to mention is that, we're not focused on, deaths in terms of the modeling that we've been doing. We are focused on cases and hospitalizations to help inform that model.
Okay, thank you.
Mark from the Pioneer.
Go ahead, Mark.
The U.S. Department of Health and Human Services, as well as the Office for Civil Rights, announced April 2nd that it will exercise its enforcement discretion and will not impose penalties for violations of certain provisions of the HIPAA privacy rule for disclosing medical information. Will South Dakota follow suit on that?
I mean, we definitely have a focus on within the purview of our existing laws to release information as we have the capability of doing so. But that does not specifically relate to identifying individual persons.
And so it's appropriate that those federal agencies would, relay the action that they will or will not take if it's not enforced at the state level. We have to comply with it, but it's not enforced at the state level.
Next question.
This is Bob Mercer with Police. What county did the deaths occur in?
So the deaths occurred in Beadle and Minnehaha counties.
Thank you. And
Next
This
question.
is Stephen Groves from the AP.
Go ahead, Stephen.
So with this being I believe the largest single day jump in the reported number of confirmed positive cases, how does this track with the modeling? If this trend continues with confirmed cases in the 40s, is that higher than what you've seen and predicted with the modeling?
So in focus, I mean, what we need is several days of, the same sort of trend being seen. What I can say is that, looking at the data, we do have some variability in terms of day-to-day number of cases that are reported. And so it would be too early at this point to identify if this is meaningful in any way relating to the number of cases that we can continue to expect. What I can say generally, and this is information based on the modeling that we have done, is that obviously we consider that we will be seeing more and more cases, for many more weeks.
This is Bob Mercer with KELOLAND News again. How do you know that a patient has recovered? Is there a standard for that? Are you retesting them to prove that?
So the old standard, which we don't use from CDC, is focused on testing of individuals. But as about 3 weeks ago, CDC put forth a general criterion for how to identify somebody as recovered, and that is what we are using. And that is, a person is considered recovered when they have had no fever for at least 3 days, and that they have an improvement in their respiratory symptoms, and the person has been in isolation at least 7 days after their first symptoms appeared. So a person at a minimum will be considered recovered after 7 days, and that may be longer depending on their duration of fever as well as their general improvement of symptoms.
Adam St. Paul, Dakota Broadcasting.
Huron Daily Plainsman.
I'll take the reporter from the Huron Plainsman.
Yes, just a question. I know we've got more tests being done right now, and I noted in just kind of taking the math on this that this is still under 10%, and from what we've been tracking, we've had 1 day since the state labs or the private labs came on board where there's been over 10% of positive cases. Is that something that, we're seeing larger raw numbers? Is that more what is being tracked at the department's end? Is that percentage of positive cases? Because we are having more tests come in, so therefore raw positive numbers are obviously going to be substantially higher.
Yeah, you're exactly right that, when we're looking at the number of positives that we're reporting, it's also important to keep in mind the total number of individuals who have been tested. And so, the information that we're looking at, is looking at in total, what is that percentage on a daily basis, and what is that moving forward? The idea being that as we see more transmission, of COVID-19 within communities, that rate of positivity from the laboratory testing will increase as well.
Next question.
Adam St. Paul, Dakota Broadcasting. I've seen conflicting reports on this nationwide, I guess, and I'm just curious if you guys have any answers. When it comes to recovered patients of COVID-19, is it possible to catch the illness again? Is that something that's actually happening?
So most of the information that we know about the virus, which again is still kind of at a very low level overall, is, and we're learning more every day, is that individuals are not expected to be able to be infected with COVID-19 a second time. I think some of what individuals are seeing a little bit is, again, what some individuals are seeing a little bit is information that is being seen from China or heard about from China that is specifically focused on individuals that may have been incorrectly diagnosed the first time around, and that those individuals are now testing positive. I know I have seen a report to that extent, but to my knowledge, we've not seen that in the United States, and we've definitely not seen that here in South Dakota.
This is Mark from here again.
Go ahead.
Previously, CDC guidance was to only test to a person if they have come in contact with a person that they know tested positive for COVID. Has that guidance changed at all?
So the general guidance from CDC, which did change, 2 weeks or so ago, is that individuals just need to have the general symptoms of COVID-19, which is fever or cough or shortness of breath, and that individuals are able to be, should reach out to their clinician, as that clinician is going to be the person to help make the determination of whether or not they should or can be, really be tested.
And when people do exhibit those symptoms, they call their healthcare provider, and they're still told you don't qualify for a test. What's the guidance there? What's the disconnect?
Well, without knowing specifically the circumstance, it is left up to the clinician to make a determination about testing. When individuals are turned away, that might be something where they have a suspicion of another infection, or the person might not have the characteristic symptoms. And I know that there are a number of people that are still looking to be tested even though they are asymptomatic. So I would just help reinforce the fact that individuals that are experiencing symptoms do need to contact their clinician and work with the clinician to identify whether their symptoms meet the criterion to be tested.
All right.
This is Trevor Mitchell, Argus Leader.
Again from
Trevor, go ahead, and then we'll take Ray.
Yeah, do you have the age range and the sex of the two new confirmed deaths?
So that is not the information that we readily relay. We do relay the information that that we have two new deaths and which county those individuals are located in.
Ray Yost from Kella.
Hi. Yes, you would expect increases in Minnehaha County based on its population, but is there anything alarming there about the pace at which those positive cases are increasing, or is it simply attributed to more testing?
I think it's something that, right now Minnehaha County is seeing an increased number of individuals being identified, and that, I don't anticipate that they're going to be the only county that sees additional positive cases in a very, very rapid manner in that way. So I think that's something that we do need to keep in mind as we move forward in this, that there are going to be many additional communities that are impacted by COVID-19.
All right.